Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health, reporting for the week of August 4th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. This week, after an update on COVID and measles, I'll review a new report on vaccination exemptions and coverage for this past school year, as well as a recent study on the relationship between wastewater and infections as it relates to SARS-CoV-2. First, let's take a look at respiratory viruses that basically take people to a clinical setting to get tested. And what we're seeing is that rhinovirus, enterovirus, so kind of the common cold, is still the most common in that gray line, but that's followed by COVID, SARS-CoV-2 in red, which is the only one that's really clearly heading up at this time. And this just kind of gives us a snapshot in time. Next, taking a look at wastewater, we can see that every region is essentially heading straight up at this point. So although it's still considered low nationwide, which is represented by that black line, you can see that it's heading up just along with everywhere else. And at the top here are the West and the South. And we'll talk a little bit more about how this may correlate to things in a moment. But first, taking a look at epidemic trends. And remember, this is showing us whether COVID infections seem to be growing or decreasing by state. And the light purple means it's likely growing, and the dark purple means it is growing. And this is using modeling, which is based on emergency department visits, to see what direction things are heading. And clearly, really almost the vast majority of the country really is either likely growing or growing. So the ones in gray are not changing, and those couple of states in white, we just don't have the estimates or enough information. When we look a little more detailed at emergency department visits, so this is showing emergency department visits by age groups, and those age groups are listed there along the bottom. And this is showing us about the last year. So if you look over to the far right, you can see what we're seeing in terms of emergency department visits for COVID. And that is through July 31st. And by far the most is taken up by 0 to 11-year-olds. So our little ones are the ones that are going to the emergency department disproportionately for COVID. And next would be the 75 and up age group in the darker purple line. So you can see that right around mid-June is actually where the crossover happened. And so prior to that, for quite some time, hospitalization or emergency department visits were highest in the 75 and up age group. But we can see here last year that also we had a period of time in the summer where the children were the ones most likely to be going to the emergency department with COVID. So this is happening again. It's been going on for about 6 weeks so far. So we'll continue to keep an eye on this. And remember, the kids, for the most part, are not back in school right now. Presumably, they're outdoors more. So it is concerning to see that this crossover has already occurred and that our young people are being impacted disproportionately. Hospitalizations with COVID, that's in the orange. So it's coming up slightly. And hopefully this will stay kind of low like this. This is certainly looking better than we were looking in this past winter, and definitely much better than last summer. But we'll just have to keep an eye on it because, as we've already seen, things are heading up at this time. And as expected, both flu and RSV are pretty much nil at this point, which we would expect until we head into the season again in the fall. And taking a look at deaths, still looking pretty low. We are at 165 confirmed deaths for the week ending July 5th. And that's up a little bit from the week before that, but this is, within the range of fluctuation, probably. Not sure that that indicates a direction we're going, but we'll see as more death certificates come in and as time goes on. But we have been under 300 deaths per week since early May for the first time in the entire pandemic. So this is overall positive news in terms of deaths being lower than 300, and we'll hope that they stay low even as we see cases go up. We're really hoping that this doesn't have a significant impact on hospitals and deaths as it has in the past, but we will continue to keep an eye on this. And taking a look at measles, the measles outbreak in the United States continues. We have had 1,333 confirmed cases as of July 29th. So this is more than 4.5 times what we had the entire year last year in 2024. And we're really only 7 months in at this point. And this does represent a 33-year high in terms of measles cases. So of course, very concerning. And out of these 1,333 cases, 13% of them were hospitalized. So 169 people hospitalized. And there have been 3 deaths, as well as at least 1 in Mexico. We know that Mexico and Canada have also had ongoing outbreaks. And this year so far, 87% of the cases are associated with an outbreak. So that is certainly indicating that there is local transmission of measles, and this is what is really driving this outbreak. By comparison, last year, of course, was a much smaller number, 285 cases the whole year last year, but only 69% of those were outbreak associated. So more of them proportionately were imported in rather than transmitting locally. And remember that measles is not something that we want to be taking lightly. This is not something we want to be taking chances with. It can lead to respiratory failure, brain inflammation, or encephalitis, which can lead to permanent brain damage. It can cause blindness, it can cause deafness. It causes death in 1 to 3 per 1,000 cases, even with the best medical care. And it's also really important to recognize that measles seems to wipe out parts of the immune system so that you then become susceptible to more infections even after recovering from measles. So for suspected measles, contact your doctor or your public health department immediately. Now I want to share a report published last week on July 31st called School Vax View. This is a report that's published every year by the CDC, and this one is regarding the 2024-2025 school year. And it paints a rather disturbing picture of where we are and where we seem to be headed. During the 2024-25 school year, vaccination coverage of kindergartners in the United States decreased for all reported vaccines compared to the year before. So we're right around the 92% range on average nationwide. Now, 92% might sound like a good number, but it is too low because for many of our childhood illnesses, we need to be at about the 95% threshold to maintain that population immunity, which I'll talk more about in a minute. Coverage with measles, mumps, rubella, diphtheria, tetanus, pertussis, poliovirus, and varicella virus vaccines decreased in over half of the states in the nation compared to the year before. And about 286,000 kindergartners attended school without documentation of completing their MMR vaccine series. And remember, this is just about incoming kindergartners. So with each year that this continues, this adds up to fewer and fewer protected people. Now, when it comes to exemptions from 1 or more vaccines increased to 3.6% from 3.3% the year before. Exemptions increased in 36 states and the District of Columbia. And 17 states reported exemptions over 5%. So again, risking dropping below that population immunity for those incoming kindergarten classes. And this will just keep adding up as this trend continues. About 138,000 kindergartners were exempt from one or more vaccines last year, and the vast majority of these exemptions are not medical. As we can see here, this is looking at trends for over the past decade. And you can see that the medical exemptions, represented by the green line going across the bottom, are flat. And this is because there are truly very few actual medical reasons to not receive a vaccination. On the other hand, non-medical exemptions, represented in the purple line, have been heading straight up since the 2020-2021 school year. I've linked all this information in the post. There's actually an interactive tool there where you can see what's been going on year over year as it relates to each of the different vaccines and the different exemption sites, exemption statuses. You can also see what things look like state by state. You can look at it on a map, and you can look at vaccine coverage by vaccine. And you can see that there's quite a bit of variability across the country. Some states like California don't allow non-medical exemptions for school entry. So those vaccination rates for kindergartners are thankfully holding more steady in those states. But as we know, viruses do not respect borders and boundaries, so this trend can truly affect any of us. The states with the highest exemption rates are Idaho at 15.4%, Utah at 10.3%, Oregon at 9.8%, and Arizona at 9.1%. And as I mentioned, there are 17 states that are over 5%. So using Idaho with its 15% exemption rate as an example, only 78% of kindergartners there entered kindergarten with the polio vaccine. So this is how you make your population vulnerable to a debilitating disease like polio. Everything's fine until it isn't. Everything's fine until someone maybe travels to a place that still has polio, comes back, and now you can end up with this condition impacting someone here, paralyzing them. We could even see onward spread in a community where vaccination rates are low. And of course, this is not just theoretical. I just reviewed the worst measles outbreak we've had in the United States in decades. And this is by and large a direct result of low vaccination rates among children, in particular for measles in this case. So these numbers may sound small, the changes may sound small, but they are not. This is actually a huge flashing red light for public health. Population immunity is like an invisible shield that protects the most vulnerable among us. And when we lose that shield, those people are now unprotected. And this includes newborns who are too young to be vaccinated, people with weakened immune systems, those who can't get vaccinated for actual medical reasons, and also those who, for whatever reason, do not mount a good response to the vaccine. So unfortunately, vaccine preventable diseases are no longer a relic of the past in the United States. Now our children's classrooms, public places we might visit, airports, airplanes, public transportation, these all may have a higher risk of outbreaks like measles or whooping cough than they did just a few years ago. So this means we have to be more vigilant. We have to be more proactive about protecting ourselves and our loved ones, especially if we have unvaccinated babies in our lives, people who may be medically fragile or immunocompromised or unable to be vaccinated. And even those willingly choosing not to have their children vaccinated may be operating off of false assumptions based on the past, based on the life as they have known it so far, where we've all enjoyed population immunity. But as we lose that, these assumptions will not hold. Unfortunately, the increase in exemptions and decreasing vaccination coverage is something that is being promoted by the highest levels of our government. The decision to be vaccinated is being framed as an individual decision, only, even though our individual choice in this case has ripple effects that can impact everyone. But somehow that fundamental truth is being completely left out of the conversation. Our so-called healthcare leadership in this country seems hyper-focused on individualism and personal choice without even mentioning the effects on the population at large. When we talk about public health and don't actually talk about the public, this is not just an error or an omission. This is downright deceitful. So it's even more critical now than ever that we check on our loved ones, especially if they're vulnerable, especially if they live in places with low vaccination rates. We unfortunately no longer seem to have the luxury of being in a country where we can be protected simply by the modern advances made available to us. We have to actually actively choose to use them. And now it seems we have to also defend them or we lose the protection they provide. And finally, I want to briefly review this article published in the Journal of Infectious Diseases on July 24th, 2025. And this is a pretty interesting article that looked at the correlation between wastewater measures of SARS-CoV-2 and the frequency of COVID infection in the community. And I thought this was an important one to review because we often look at SARS-CoV-2 in the wastewater on this briefing. And of course, how we've been able to look at wastewater has evolved over time as we went from having very little infrastructure in this regard to a lot of sites collecting it to now seemingly things stabilizing where some communities, but not all, are doing wastewater SARS-CoV-2 surveillance. This study was conducted in Minnesota over a 32-month period from 2022 to 2024, looking at the correlation between symptomatic COVID in healthcare workers and SARS-CoV-2 in the wastewater in that community. So they collected 215 wastewater samples over the 32-month period, and there were 6,879 positive SARS-CoV-2 tests results reported to the Fairview Employee Health System. That's the health system that they were looking at, from those health system employees who lived in the wastewater catchment area. So I thought this was a pretty clever design to overcome the fact that in general, we don't get COVID test results for people anymore. And they overcame that by focusing on healthcare employees who are required to test for SARS-CoV-2 when they get sick. So over the 32-month study, there were 3 surges in viral activity. The authors did make sure to note that they were not able to draw conclusions about seasonality. So join the club. There's not been any real pattern of seasonality of SARS-CoV-2. But what they did find is an indisputable relationship between the SARS-CoV-2 levels in wastewater and the frequency of symptomatic COVID cases among those healthcare employees who lived in the catchment area of the wastewater facility. And there was a delay of about 1 week. So this is a bit of a busy figure, but it visually represents the main finding of the study, which is the relationship between SARS-CoV-2 levels in the wastewater and the frequency of symptomatic COVID cases among Fairview Health Services employees. The red circles represent the frequency of symptomatic COVID cases reported by employees in that specific weekly interval. So the higher up the red circles are, the more employees reported a positive test that week. And the blue circles represent the number of copies of SARS-CoV-2 per liter of wastewater measured in that same weekly interval. So when the blue circles are higher, that indicates more virus detected in the wastewater. And then the dotted line is the prediction from one of the 2 models they used in the study, showing how well the model predicts symptomatic COVID cases, which again are the red circles. So this figure clearly shows that the peaks and valleys of the blue circles, the wastewater virus levels, closely align with the peaks and valleys of the red circles, the symptomatic COVID cases. And most importantly, the increases in the wastewater levels came before the increases in the COVID cases by about a week. So this illustrates the study's conclusion that wastewater levels can indeed predict upcoming surges in symptomatic cases. So, of course, like any study, there are limitations, especially the fact that this is a relatively stable population of working age adults that are working in healthcare. So that may not generalize to the rest of the population. This was also done in one metropolitan area, so it may not generalize to rural areas or areas where there's more moving. But the data they collected demonstrates clearly that the levels of SARS-CoV-2 and in the wastewater predict the frequency of symptomatic COVID cases in the community approximately 1 week in advance of the clinical cases. So I think this is a great endorsement of continuing to do wastewater surveillance. It's also something that individuals and institutions can consider if they have wastewater or sewer sheds reporting on this in their area. And it may also set the stage for doing similar studies looking at other contagious illnesses like flu and RSV to help us be more focused in our preparedness there. So with SARS-CoV-2 and the wastewater increasing across the country now, this might be something you might want to take a look at in your area or an area to which you might be traveling. But either way, we do know that cases on average are increasing at this time across the country as our emergency department visits. So let's remember to keep up our best practices to keep ourselves and our loved ones safe and avoid the spread of SARS-CoV-2. Remember, gathering outdoors is almost always safer than indoors. But even indoors, you can really improve the situation by opening up some windows, improve the ventilation, turn on your HVAC system and or HEPA filtration units within the space. Also use a high quality filtration mask if you're mixing indoors, especially where there's poor ventilation and in crowded high traffic areas. And try to avoid infection and reinfection. We know that there is a cumulative nature to the effects of COVID as well as increased risk of long COVID, and that risk is with each infection. And if you don't feel well, please test to rule out COVID. Want to do this as soon as possible, as soon as you have any symptoms, and in particularly if you're someone who should be treated for COVID, get treated. There's a small window of time to really reduce that virus replication and prevent going into a more severe case. And if you don't have a primary care provider, please get one. Know how to reach them before you need them. And again, if you're someone who should be treated, then having a treatment plan ahead of time is certainly helpful, because trying to figure it out when you don't feel well is definitely not ideal. And remember to eat a balanced diet and stay well hydrated. Avoid those simple sugars and processed foods. And quit smoking, reduce alcohol consumption. If you don't feel well, please rest and recover. Otherwise, try to get some regular physical activity, get outdoors, get some fresh air, manage those stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.